Hi, I'm Dr. Shelley Safian, one half of the author team of Safian and Johnson for You Code It, this exact book. And we wanted to share a little extra something to help you as you go through You Code It to practice what you have learned in all of your coding classes. So this video is going to discuss cases of diabetes mellitus, which are included in Chapter 7 because patients diagnosed with diabetes mellitus will be treated by an endocrinologist. Let's take a look. Okay, diabetes mellitus means that the body, most particularly the pancreas, cannot properly process insulin in the body. And the signs and the symptoms include polydipsia, which is the medical term for excessive thirst, polyuria, excessive urination, unusual weight change, fatigue, blurred vision, slow healing, sores, or cuts. And you, of course, know this as these are the signs and symptoms for diabetes mellitus. They are what are known as inclusive diagnoses and therefore are included with the diagnosis of diabetes mellitus. Now, interestingly, there are now 5 different types of diabetes mellitus that you may read about in your physician documentation if you are coding for an endocrinologist. Type 1 diabetes used to be called juvenile diabetes. It is a condition that patients are born with. They call it juvenile diabetes because it most often is diagnosable early in the patient's life when they are very young. Okay? It's also known as insulin-dependent diabetes mellitus. That's an old-fashioned term. All it means is that the patient is required to take insulin every single day. And therefore, use of insulin for a type 1 diabetic is not reported separately. But we're going to talk about other cases in a minute, okay? Type 2 diabetes is acquired through a person's lifestyle as well as some inherited possibilities. And the type 2 diabetes can be reversed with change in diet and exercise and sometimes some medication. That's the good news. Okay. Type 3 diabetes is brand new. So we wanted to just mention this. It actually is a precursor, they think, to Alzheimer's disease. And like I said, it's brand new, but we wanted you to at least be aware of it. Should you read about it in documentation, query the doctor if you don't know. Secondary diabetes mellitus is, there are some conditions and even some drugs, medications, that can cause the patient to develop diabetes mellitus, and so therefore that would be secondary to whatever the original condition was. And gestational diabetes mellitus, which is developed during pregnancy by the pregnant woman, you might imagine, okay? And then once the baby is delivered, that goes away. Okay, so let's talk about the tests that are required to diagnose diabetes mellitus, and those would be blood tests to test the glucose levels within the patient's blood system, okay? And so there can be casual plasma glucose, a fasting plasma glucose, and plasma glucose quick test, which is in 2 hours. So normal blood glucose levels are less than 110 milligrams per deciliter. Okay, so now we're at the coding. So you have 5 different types of diabetes mellitus. There are 5 different code categories with which to report this condition. So this is the first thing you're looking for in the physician documentation, exactly which type of diabetes mellitus is this patient diagnosed with. And you can see you have 5 different, now be careful, E08, 09, 10, 11, 12 is missing, and then there's E13. Okay. Now, the next thing that you, before you can even determine the ICD-10-CM diagnosis code, you must look to see if there are diabetes mellitus manifestations identified and diagnosed within the documents, because these are what we call, the codes for diabetes mellitus are what we call combination codes. So in other words, they tell a whole story sometimes in just one code. You don't need 3 or 4 codes. But so therefore you have to know all the information before you go looking for the correct code. So ophthalmic diabetes mellitus is known to affect the eyes, the nervous system, the kidneys, as well as the cardiovascular system. So you need to look for notations about diagnosed manifestations of this patient's diabetes, and the documentation has to connect them. This cannot be, oh, the patient also has. The documentation must say diabetes related or diabetes caused. Very important. All right, and here's just a little teeny tiny smattering of what I mean by combination codes. E11, 21, you'll see they're all type 2 diabetes mellitus, but then they all have that little word with that secondary, the diagnosis confirmed as a result of diabetes, that manifestations such as neuropathy, which you know is nerve pain, chronic kidney disease, diabetic cataract of the eye, diabetic dermatitis, the skin, periodontal disease. I know, diabetes mellitus is the gift that keeps on giving. Okay. There are times when you may need additional codes to that one single combination diabetes code. Check the documentation. If the patient is long-term insulin use, and remember I mentioned this before, type 1 diabetics will not be given this second code because we already know a type 1 diabetic must use insulin every day, so there's no reason to clutter things up by being repetitive. However, type 2 diabetics, gestational diabetics, secondary diabetics may not necessarily use insulin for long term, and so therefore that would require a second code. Now, insulin hypoglycemic use would indicate there are special medications to address type 2 diabetes, not the same as type 1. Type 2 hypoglycemic drugs, so if the patient has been on this for long term, that needs an extra code. And if there's more than one type of drugs, long-term use, you need to report that also. All part of our jobs to tell the whole story. Okay, standing reminder, diabetes mellitus is a systemic condition. As you just learned, this one condition that involves and starts with the pancreas and the way the pancreas works can affect every other body system. So therefore, because it's a systemic condition, you will always report this as a secondary diagnosis code, regardless of why the patient is there to see the doctor, because it's always a consideration in every aspect of this patient's health. Okay? All right, chapter 7. Now go forth and practice what you have learned. All of the following pages include physician documentation from actual patient visits to an endocrinologist. And you know what? There are a couple of patients in there who have diabetes mellitus. All right, if you have any questions, ask your instructor.